Hi everybody. Today I kind of like to go a little bit deeper into as far as what is considered an ACA certified plan. There's certain parts to an ACA plan that it has to have in it for it to be ACA certified. Of course, it has to have your major medical, which consists of hospitalization, ambulatory services, emergency services, chronic disease management, which is your wellness cares. It also has to cover lab tests, of course, and it also has to have pediatric services for children, which sometimes include dental and vision. It also has to have coverage for all pre-existing conditions. It has to be guaranteed renewable. It has to have no lifetime maximums, which means no matter how much you use these plans, they have to cover it. It has to have coverage for prescriptions. It has to have coverage for mental health and substance abuse treatment. And of course, it has to have coverage for maternity and newborn care. Now, on the private healthcare market, everything is kind of set up pretty much the same way. But unlike on the ACA, that there's certain things on a private healthcare market that it doesn't cover. For example, on the private healthcare market, one of the things that most of the plans doesn't cover is pre-existing conditions. There is certain plans that are out there that will cover up to like $25,000 of a certain condition. There is new plans that are coming out this year in 2019, 2020 that the first year you're on the plan, it won't cover any pre-existing conditions, but it will pick up those conditions into your second and third year. It has a maximum, most of the plans have a maximum on it of anywhere from $1 million to $2 million. There is not prescription coverage on it, although there are third-party plans that you can get for prescription service if you do have a high deductible on a particular medication. Some plans will cover certain parts of mental health, but most of them doesn't cover anything when it comes to substance abuse. And there's also plans out there that will help you cover maternity and newborn care. The other thing I should mention also is to be an ACA certified plan. This all has to be from one vendor. The difference between the ACA and the private healthcare market is that I can get the same coverage. I can provide you with the same coverage as an ACA plan, but because they're through different vendors, that keeps it from being ACA certified. Okay, so that's kind of the difference as far as what your coverage is, the coverage difference between an ACA certified plan is and between the private healthcare market. Watch for the next video where I go a little bit more deeper into the ACA again, what you can expect on private healthcare market. I'm Mark Jacobs with MJ Benefits Advisors. I expand your benefits, not your budget.